where we're talking about the latest in trends, technologies, and innovations happening across the healthcare and media spaces. I'm Amanda Preto, and I'm here today for an exciting conversation with Julie Hurvitz Aliaga as we celebrate and honor Women's Health Month. And then we're going to segue into a topic on innovations, partnerships, and research, and how when CMI Media Group combines all of those forces, we're able to deliver custom, innovative ideas for our clients. Let's get started. All right, Julie, it's so great to have you on Nth Degree today. We've been working for months now on some really important and meaningful research. I'm excited to have you on to talk about what we've just pulled through in our Media Vitals findings in terms of women's health and women's health treatment and education. I know you and I have done a couple of mini road shows already, but I think let's start with the basics. 51% of women make up the world's population, and yet a lot of disease states and conditions that are unique and affect women often go misunderstood or misdiagnosed or frankly ignored. Mm-hmm. So with this kind of collective effort that we've been working on, I wanted to today bring to light some of what we've been finding, especially around the new consumer data that we've collected from Media Vitals. Talk to us, Julie, about the disease states and conditions that we're focusing on in Media Vitals and what we're seeing. What's the research telling us?
I mean, when you talk about different disease states such as cardiovascular disease, mental health, chronic pain, and conditions like menopause, we have found that there is a great need and also great excitement, right, for more education, more research to be done in these areas. I think one of the most alarming stats for me was that 70% of people with chronic pain were actually women. Yet when you look at studies that have been done on chronic pain, it's been done 80% towards men, conducted on men, right? So that's just one example of where we can really look towards women, towards research and opportunities to maybe do a little bit better as an industry to make sure we're pulling through that data. When we look at stats like caregiving, right, 65% of caregivers, Amanda, I know we talk about this all the time, are women. It's not saying men are not caregivers. There's still 35% of them. But when you look at such a large statistics like 65%, and you see that women are making up the 65% of caregivers, we need to make sure we're empowering each other with research on ways that we can take care of their mental health, take care of their anxiety, take care of their physical health. Like we talked about cardiovascular disease, diabetes, obesity. All of these diseases affect women, and we might not be doing such a great job at empowering ourselves to really take care of ourselves, right?
I agree, Julie. And I think, this is something we talk about beyond Women's Health Month, and it's something we're looking at pulling through year round. But to your point, I'm so glad you focused on both mental and physical health and the stat around caregiving. We're seeing, and this is not, a story of two tired working moms. This is statistical data points to women prioritize other facets of their lives before they prioritize themselves and their own health. And there's a lot we can do as marketers to help both physicians and the female population better understand what's available to them when it comes to healthcare treatments, options, information. So I fully agree with what you were saying. To that end, what would you say we can do, Julie, as marketers to ignite change?
Yeah, before we get to what we can do to ignite change, I also think it's very, very important to look to what history can teach us. I know you and I have talked about this on a lot of our panels, but women were excluded in studies up until 1986 from clinical trials. And it was not actually enforced that women were included in clinical trials until 1993. And I know when we talk about that in a lot of our conferences recently, we get this feeling in the audience, and we're like, yep, that's true. So I think before we can look to ignite change, it's very, very important that we educate not just the women, but the men, the allies in our lives as well, to say that history has not been so kind to women when it comes to these topics. But now we have a really great opportunity to do better, right? So when we're talking about what marketers can do more of, it's this, having these conversations, looking to the research. We do a lot of great research here at CMI Media Group, as we all know. How can we dig into the data and the research and help our brands, help our marketers understand where we can meet women? Women of all shapes, sizes, colors, backgrounds, all of these things matter. And all of these pieces are what makes up a unique woman and her needs.
That's so awesome, Julie. Thank you so much for your leadership on this, and to your audience intelligence team who has been digging into that data, like you said, and really tying the data to the story, and bringing this to light for all of us. When research meets innovation, it means big custom ideas for our clients. So we are here today with the team who is leading those big custom ideas and driving engagement and moving the needle. All the things we're trying to do in pharma marketing. So let's introduce Julie, Mark, and Liz. Mark, take it away. Tell us what's going on when research meets innovation and what cool things we're doing for clients these days.
Yeah, so I mean, we've been working on a lot with Liz and team, really helping to dive into the audience insights. Hence the name audience intelligence, to really see what's out there, what channels are being consumed by specific patient populations. Because uh, somebody that has a type of cancer is probably going to be consuming different types of media than somebody that's going through a loss of vision and dealing with macular degeneration or something along those lines. Recent example of that is working closely with Liz's team to pull in a lot of insights, specifically in the audio space, about how people with vision issues and macular degeneration are starting to consume, or not starting to, but how they're consuming different pieces of audio, and then looking at that versus other types of media and really helping us to make a full recommendation for our clients. So we were really able to do a deep dive into looking at podcasts and streaming, and even looking at audio as a digital therapeutic for this patient population, and really building out a full recommendation, and creating some partnerships with different vendors we work with on the audio space to bring this full to the client team as a really full baked recommendation and offering in the audio space, specifically tailored to the patient population, off these insights that Liz and team brought forward to us. Liz, I don't know if you want to jump into any of the
Yeah,
details
I
around
was just
the magic you do, but
yes, all magic over here, all with the data. So yeah, I think that's a really great example of the macular degeneration and also DME, which is specific to diabetes. But with this audience, it's really unique and it just highlights the need for our team to partner very closely with innovation to make sure we're finding the right opportunities. With this audience, they're typically older, so 65 plus. And as you can imagine, that audience has very different media habits than a younger demographic or a condition that may affect a different population. And so what our team does, Mark may come to us and say, hey, there's this great idea. We want to learn more about audio in this particular demographic or patient population. And we kind of take that, go through all of the sources that we have access to, which is our Media Vitals data, Empower, our syndicated tools. And we really dig through to identify how this audience is different and behaving differently than others to really fine tune what those opportunities are. So, for example, when we looked through this case study, we found that for the 65 plus audience who have DME or AMD, they're spending up to 2 hours a day listening to radio, and some over index for radio over television. And also just thinking about visual impairments, audio is just a great resource to have, and also a great place to be for people who may not even be able to really enjoy television the way others are able to. And so just again, a great way of how we're partnering and really leveraging all of the data that we have here at CMI Media Group to really, really fine tune and be strategic about the innovative opportunities that Mark and team are pulling through.
yeah, and I think it's for like a team with the word innovation in the title, which can be defined differently by any person that you ask. Oftentimes, people associate innovation with like a bright, shiny object, or something forward facing. We want to make sure that anything that we are bringing that's a new idea, something that's seen as innovative to the client, is actually serving a business need and a business purpose and reaching that targeted patient population. So that's why working with audience intelligence really helps to really solidify like our decision making and some of the ideas that we're bringing forward with partners. I mean, getting into things like the gaming space, or working with creating custom agency partnerships with different social platforms. We want to make sure that whatever we're recommending or providing is really rooted in insights and knowing that we're actually going to target who we're trying to target, instead of just trying to get somebody to do something new for the sake of doing something new. So that's really important that we can back up any recommendation that we're bringing forward with this data.
All right, Liz is going to talk to us about how the teams work together. Liz, can you give us a closer look at that, how the data is taken in and what happens after that?
Yeah, of course. So, as I mentioned, our teams first look at all of the data we have available because just have a ton here. We always start with our Empower data, Media Vitals at our core, and then from there look at our syndicated tools to really help us to shape the initial picture and look at all of the data that we have available. So Mark and team have brought so many wonderful opportunities within the pharmacy space, whether it's directly with pharmacists or digital out-of-home opportunities. And for this client, we really wanted to understand of the audience, which pharmacies are their preferences? What are they doing when they go to the pharmacy? How do they interact with the pharmacist when they go? And that custom data can only really be gathered through custom solutions and surveys. And so that's also where our team really works to help refine what those innovative opportunities are for the clients and really pull through at a very tactical level what this means for our clients and making sure that it's very much aligned to the patient's needs and tailored at every way possible. With our custom solutions, it's surveys, again, that can be defined specifically around understanding a little bit more of what these audiences need. But also on the back end, if we launch an innovative campaign, our team is also there to help provide additional campaign effectiveness studies. So pairing that with campaign performance metrics that we get from those partnerships, but then also layering in what did this actually do for this audience? Did it provide additional education? Did it provide additional resources? And that's, again, where our teams are really partnering on the back end. So full process from beginning of understanding the audiences, of who they are, what they need, to how did this actually impact them in their journey for our clients.
Yeah, I mean, I just want to jump in and add in my 2 cents there, but it's really important depending on also like where the patient population is actually concentrated across the U.S. because going back to like the pharmacy examples and the evolution of pharmacy, which is something we've been working on, we've been working a lot with, where now Walmart has really transformed from a point of care to like a point of health. Most times, people especially in the rural parts of the country are closer to a Walmart than they are to any type of treatment center or hospital. So that Walmart center is now their point of health. So being able to see where this patient population is spread out throughout the country, it can help us identify new opportunities like partnering with Walmart to do mobile health clinics like in the parking lot, where I think like one of the stats is like 90% of people are in the country or within like 10 miles to a Walmart. But if you're in like Nebraska, your doctor might be like 50 miles away. So being able to see like these pockets of where the patient population is distributed across the country, it can help us work with some of these brick and mortar pharmacies to come up with different ideas to reach these patients and be much closer to them than their doctor is.
Yeah, exactly. And I think that's exactly what our surveys are helping to answer is, of course, in the data we have access to, we know that they go to pharmacists and pharmacies, but are they going to a Walmart or a CVS? Do they actually interact with a pharmacist when they're there? And so those are the types of questions that we're looking to answer through that deeper, more custom solution.
That's a great point. Thanks for adding that. So Julie, you are leading the audience intelligence pillar at CMI Media Group. So while it does look like magic on the forefront, I know there's a lot that goes on behind the scenes. Can you just give us a little bit of a peek at how the teams do cross-function together and how that delivers such impactful deliverables for our clients?
Yeah, absolutely. And the nice thing is, I mean, you heard just now from Mark and Liz, both of these teams work hand in hand. And I think all of us think of ourselves as innovators in some way, shape, or form with what we do, right? So you look at what Mark does and his team of innovators do, and they're able to pull through some really unique partnerships and ideas. But then you look at what Liz and her team does on the audience intelligence side, and we are honestly breaking new ways of doing research here within that team, right? So from finding new partners, finding new ways of pulling through research, finding new opportunities to really hone in. We talked about audio, for example, honing in on new suppliers and new partners that can dig into data as it relates to audio consumption. We're able to really be innovators in that way as well on the research side. So when you combine these two teams together, you don't have a team that's not willing or ready to think a little bit differently. You have a team of researchers who are innovators, and then you have a team under Mark who are innovators from the media and activation space, right? So I just wanted to start off by saying that because I do think it is a very special partnership that we have under these two teams. And without that, I don't think we would be as successful as we are today. But when we talk about how these two teams work together, I think Liz said it best. I mean, we really start with the research. So we are every single day pulling through research from every single patient population, disease state, all of the above, right? And then what we're able to do if Mark comes to us or someone from his team comes to us and says, hey, I have this new brand and they need X, Y, and Z because their goal is this. I'm being very vague because I'm trying to protect our clients. Liz is able to quickly pull through the research with her team and say, you know what, Mark, this is a great idea. However, it might not work for this patient population. Let's think about this instead, right? So they're able to then keep that loop going when we pull through the research and we pair that up with the great ideas that Mark and his team have. So I know I'm gushing over this, but it really is a beautiful partnership that would not be as successful without the wonderful people that we have here.
It is an amazing team doing amazing things. Thanks, Julie. So, Mark, where do the partnerships fold in? Can you talk to us about how what you're doing in terms of partnerships is also creating these new opportunities for clients and how it's impacting the work?
Typical pharma destination. So we're really focusing on like the non-endemic side of things, like partnerships with Uber and other platforms like that, because we know that like people are not defined by their condition. People are actually people and living their lives, so they're using all of the same things that everyone else is using. So why not be where they are throughout their daily life, and not everybody's just living on some endemic site, reading about their condition 24 hours a day. They're going about their lives, and so we can be there in all these different touch points. So really, it's about identifying new and innovative ways to not only reach the patients but also sidestep a lot of the competition, because oftentimes some of our brands are competing with brands with these massive budgets, and some areas might kind of be completely flooded from a competition standpoint, but there may be a lot of other ways where things are wide open. We're able to make recommendations, identify key partners, and start to develop some unique, whether it's an agency exclusive offering or come up with something that's new and hasn't been tried before in the pharma space, can really help us reach the targeted patient or physician population for that specific brand and therapeutic area.
I think the other thing that is special about what Mark's team does is they have been able and been very fortunate to create such wonderful partnerships with our supplier community, where we've built this trust, and Mark has built this trust with them. So when we go to them with our clients and we say, hey, we know we're in pharma, we know there's going to be barriers, and we know there's going to be maybe some resistance, whether it's on the client side or on the supplier partner side. But let's work together because this is really meaningful for this patient population. Let's see how we can get it done. I think because of the relationship that we've built with our suppliers and with our clients, there is this trust. And I think that's really important to note whenever we go forth and build new opportunities, right? This isn't something that we're just going to say, hey, you have to do this. It's, hey, supplier, hey, client, let's all sit in a room together and figure out how to get this done to better patient outcomes, or to get to HCPs in a different and unique way, because we know that they're consuming media in this way, right? So I think it's just really important to note that underneath it all, the relationships and the trust, no matter what, is, I think, what also makes this very successful.
Awesome points, Julie. And Mark, I know you were just recently at South by Southwest. You're preparing to go to Cannes in just a few short weeks. And I know a lot of that collaboration is sort of where a lot of these ideas are born from, that relationship building at conferences and events like that. Thank you so much for that insight. Thanks to this entire team for joining us on these important topics today, and to you for joining us on the Nth Degree. We'll see you again next month.